one thing about me as a provider, if I am telling you to do something, I am going to try to do it myself as well. I try my best to eat as clean as possible. I try to keep a consistent workout routine. Am I perfect about stuff? No. But one thing I've been watching on myself over the last couple of years is the fact that my glucose levels and my insulin levels have been trying to creep up. With that, I try to adjust things in diet, try to do as much as I can prevention-wise, because that is what I would preach to you if I saw those same results on your lab work. So last year, actually, I was testing out a company to use for a continuous glucose monitor. I wore it myself for a couple weeks and my mind was blown. I thought I was doing so well on diet, not realizing that certain things that I was even drinking in between, iced coffees, were really spiking my sugar, and just that my baseline sugar was staying pretty high, like in the 90s, and I just did not like that. But it's been a few months since I've done some testing. I was using that company a little bit for my patients because, like I said, if I see that your sugar levels are high, insulin levels are high, you are someone who is having trouble keeping weight off, then I would suggest wearing a glucose monitor just to see what the foods are doing to your glucose. So anyway, that company I used last year has just had some customer service issues, some supply issues, and honestly, price was a little bit high, but I liked that I could see the patient's data. But anyway, I'd seen some advertisements for another company for a glucose monitor, so since it's been a few months since I have worn one, I am going to try it again. So this is Lingo brand. I just saw it as an advertisement on Facebook. Looks like some good reviews, but the price is very good. So now you can get glucose monitors over the counter. You don't have to have a prescription for them, which is nice. So I think that has changed the game as far as getting access to them, but also pricing. So I got 2 of the sensors. That should last me for a month. I think it was $89, where before that would have been closer to $200 or more with other companies I'd seen. You can do just one single sensor for $49, I think, but the more you buy, of course, the cheaper it is per sensor. So I thought about a month of glucose monitoring would be beneficial to me. I also want to take you along and show you some of my experiments I might do with this, just to see if these results are about the same as they were last year. I have been taking berberine supplement, but I've stopped that for a few days now. I didn't want this to be skewed by any supplements or anything like that. So let's put it on. First, going to try to open it. You know, after Christmas, I am sick of instructions. These kids and their toys and the instructions. So that was pretty simple to assemble. Worst part is always looking at the needle. Why do I do that? Why am I such a bad patient? I remember last time it did not hurt at all, and I got myself so worked up about inserting it. Just because needles coming towards me, problem. Needles coming towards you, not a problem. Why is that? I'm a hypocrite. I'm literally still so nervous right now. Do not know why. Literally didn't feel anything. Did I do it right? I did it. I really didn't feel anything. Seriously. It stings a little now. I did not feel anything putting that in. We shall see how the next couple weeks go.